A long line of drivers, all waiting to be tested for the coronavirus. This is Florida, but the queues are getting longer right across America. The number of confirmed infections is gathering pace, along with the number of those known to have died from the virus. As the scale of the outbreak becomes increasingly clear, doctors are worried about their own safety.
It's the first time we've ever been truly scared to come to work, but despite being scared, we are trained to save lives, and we're committed to doing that.
Doctors say hospitals nationwide are overwhelmed and there's not enough protective gear.
There are people that literally are wearing bandanas because they have nothing better than that to protect themselves from the respiratory droplets of patients who are infected with COVID-19. And I think that's a national shame.
US President Donald Trump downplayed the dangers of a pandemic for weeks before changing his tone. But he has criticised the shutdowns advocated by infectious disease experts to bring the outbreak under control.
We're not going to let the cure be worse than the problem. At the end of the 15-day period, we'll make a decision as to which way we want to go, where we want to go, the timing, and essentially we're referring to the timing of the opening. Essentially the opening of our country. This was a medical problem. We are not going to let it turn into a long-lasting financial problem.
An increasing number of states have closed down non-essential businesses, hitting owners hard. This restaurant is trying to keep going by serving takeaways. But owner Aung Mynt owns 2 other eateries and pays $12,000 a month just in rent. He's had to lay off most of his 25 staff.
This just taking all us off surprise and also off our feet. We don't know how to deal with this. Every day is a new challenge for us. So it's very challenging, and for the most part, it's very terrible.
We will get through this, is the message from one bar owner in California. People who have lost their jobs can get a free meal here.
Oh, wow.
A small team does the cooking.
Are you scared?
Owner Tom Sopit is struggling to make sense of what's happening. Here in Hollywood, he has to pay rent of $1,000 a day.
I'm concerned. All we can do is help each other.
Help each other and hope for help from Washington.
And let's get more on this situation. We are joined by Christian Lindmeier. He is with the World Health Organization and joins us from Geneva in Switzerland. Welcome to the program, and thank you so much for being with us. What do you make of President Trump's claim that the U.S. should be back to work by Easter? I mean, that's 2 weeks from now.
We're all hopeful that any country we're living in, which is under lockdown right now, should be up and running again, literally, as soon as possible. But that will depend a lot on the measures taken in the meantime. Just the more strict we are on observing the physical distancing and the lockdown rules right now, the earlier we could back up and going all to work, not only the essential ones, and going to schools again, and so on and so forth. 2 weeks seem to be rather short notice, and let's not forget all people, as you mentioned in your report here, the people leaving New York, people who may have been asymptomatic right now or with mild symptoms, they might be carrying this all over the US right now, or all over the globe, of course. This is something we need to look at. The increased testing, which is now also happening in the US, will show us more cases. That's a very normal effect of more testing, hence more results and positive results, which is good, which will rise the numbers, of course, but this is in that way good that we then know more of what we're dealing with. We need to know how many people are infected, where these people are, where the contacts are, how to treat them, and how then, of course, to isolate them. And that means testing, testing, testing.
Let's talk a little bit more about the treatment, because we had a very dramatic call yesterday from the governor of New York saying that the state desperately needs more respirators on a much more dramatic scale. What is your assessment of the state of preparation in the United States to handle this crisis?
In general, health systems all over the world and in the US and New York apparently now are lacking resources and vital equipment to treat the cases and to patients coming in. And if we have a situation like in Italy where doctors are forced to make the decision who will get a place on the ventilator and who will not get it. This is the most horrible decision a doctor is being forced to make. And we do not want to reach that stage nowhere in the world. So science, that's on the one hand, the first hand, why we need to flatten the curve. That's why we need to press that curve down to have as little of an increase as possible in order to have as many people get treatment if they need it. That needs hospital beds, that needs ventilators, and of course that needs also the protective equipment for the medical staff. Let's not forget that. This is one of our major vulnerable groups as well. So ventilators, well, there might be ways for industry to beef up ventilator productions. I know the call has been going out. Other countries may not be in need of ventilators right now to that large amount. Maybe there's a way to cooperate. This is something on the national and binational level to sort out. But yes, WHO is also trying to coordinate this around the world to get medical equipment where it's most needed.
Christian Lindmeier from the World Health Organization, thank you so much for your perspective.
Thank you.